Greetings, everyone. Lovely to see so many people here and people who are hearing impaired, because we've got Sheila, who is doing British Sign Language for us, which is amazing. So we're really pleased to have Sheila on the call. But this is all about Paula Peters of DPAC. She's on the steering group of DPAC, Disabled People Against Cuts. And she is here to talk about this, yet again, another attack on disabled people, on all of us actually, and on GPs, this proposed sick note reform that the government is trying to push through at the moment. So I'm going to say no more. I'll let Paula introduce herself and her association, and then she's going to talk about this sick note reform proposal and how we can fight it as trade unionists. So I'm going to go to Paula and bring her in.
Good evening, everyone. Thank you very much, Carol, for the invitation to speak to you all today. So my name is Paula Peters, and I'm on the National Steering Group of Disabled People Against Cuts, or DPAC for short, as we're better known as. And for those of you who have a hearing impairment and use British Sign Language, and solidarity to Sheila, who's doing such amazing work over there. And thank you very much for making this meeting inclusive. We do have a deaf DPAC group set up by trade unionist Lee Starr Elliott of the Communication Workers Union, who is also deaf. So we welcome new members who are hearing impaired who wish to join DPAC as well. But DPAC are a disabled people grassroots campaign led by disabled people for disabled people and allies. And I can send links about DPAC to Carol after this meeting, so you can check out the website. We're also on Twitter at Disabled People Protest. And I'm also on Twitter at Paula Peters and the number 2. And I can put my email in the chat afterwards. Now, Carol saw me on the Not Andrew Marr show just recently when I talked about the recent welfare reforms that the current government wish to implement. And I have to say they are quite nasty reforms. The government are very unhappy with the amount of workers who are signed onto long-term sick leave or are leaving their jobs because they're not able to continue with them because of their disability and their access needs are not being met. And I'm sure you've seen some of the horrendous headlines in the media where Rishi Sunak has used the terms sick note culture. So let's correct him firstly. We don't have sick notes. They're called fit notes. They haven't been sick notes since 2010. A fit note is where a GP can decide whether he can sign you off because you're not well enough to go back to the workplace for a length of time, or you need a phased return to work, an appointment to see an occupational therapist, or reduce your hours. Often we see with the GPs, that general practitioners, that they're not really keen to sign people off sick if they can avoid it. But I think merging in what we're going to be seeing with the fit note reforms is they do not want doctors to sign anyone off with health-related issues. What they want to do is hand over the responsibility of fit notes over to job coaches based in job centres. Now, this is an attack on GPs because you're seeing in your GP surgeries that GPs are being replaced by physician associate or PAs as they're called. And a physician associate has 2 years of training, whereas a GP has 10 years of training. A physician associate can't sign a fit note, and also they can't sign a prescription. And there's been many cases reported of where physician associates have misdiagnosed people. And sadly, we've heard of patients who've died as a result of physician associates' input. Now, the British Medical Association are very worried about physician associates taking over a GP's role and putting safety at risk. And it ties in what we're seeing now is the DWP, Department of Work and Pensions. So you've got the DWP here, you've got the NHS here, and they're merging like this because we're seeing the buzzwords. Work is a health outcome. That's very much in the heart of NHS. You probably had doctors say to you, why are you not working? Or are you in work? That's favourite things for doctors to say. But also the FitNote consultation runs until the 8th of July 2024. We want GPs to continue to issue FitNotes, not a job coacher with 3 weeks of training. They're not experienced in our disabilities or what are the reasons for us not working where our GPs are. The GPs have the training and they know our disabilities. A job coach worker does not. But we've also seen another little heinous little policy that the government's introduced, which they're piloting across the UK across England at the moment, and this is called Work Well. So basically, if you've been signed off work from your doctor, or you've told occupational health, oh, I want to go sick and everything. Well, basically, you'll be referred for what is called a health and work conversation. Basically, they don't want you going on to sick leave. They want to keep you in a job, whether that job is suitable for your health needs or not. And basically, what it means is, say for people, disabled people not in work currently, what we're going to see is they're going to be introducing these health and work conversations at job centres, seeing what your barriers are to you not working, or what your needs are to keep you in work. Say if you've got chronic pain, for example, well, the DWP will refer you to 4 sessions of physio. If you have work-related stress, or you have depression or anxiety, they're going to be referring you to 6 weeks of counselling, which is instant access to psychological therapies. This is something that the charity Mind do an awful lot of. Well, many people in mental distress are not cured by 6 weeks of therapy, and many people in chronic pain are not cured by 4 sessions of physiotherapy. And you know that, and I know that, but tell the government that. So it's basically to keep everyone in work and to look over the barriers of how you are not working. And also we're going to be seeing GPs referring patients to this Work Well service. So handing over your medical records over to the DWP to see what the barriers are to you not working, basically. Now, we warned about this back in 2015 when in Islington, job coaches were put into 3 GP practices there. And we were concerned about data sharing of our information, but also that the GP practice was seen as a place of coercion and pressure, where normally you go to the GP for support. And when you're not well, the last thing you need is to be pressurized to make you further unwell. So this, what they want to do with the Work Well scheme is it's a pilot stage at the moment, but they're going to be bringing this in October. Tied into that, and you've seen with the Work Health and Disability reform paper that they are going to, for everyone on legacy benefits, they are going to be going over to universal credit from September of this year, which is causing great distress in the for disabled people. But also what Rishi Sunak has also said is that he wants to reform personal independence payments because he thinks that too many people since the pandemic and who've got long COVID, who've got depression, anxiety, claim universal credit, personal independence payments. And he thinks that the social security bill within 5 years won't be sustainable. Well, we have a simple message to Rishi Sunak. What about he, his wife, pretty much the entire Tory cabinet, many on the opposite bench, I've got to say, and the big corporations pay the taxes that they owe, and then we'd have the money to fund the NHS and the welfare state. The money is there. It's not going to the places that it should be. We're concerned about the personal independence payments reforms. They're looking at a 6-tiered system where you could get vouchers instead of money, where you could have a one-off payment, one-off grant for an adaptation at home, where you would get treatment instead of money. So it could be therapy or pain relief treatment or whatever. Or you may not qualify for personal independence payments at all. This is going to have a devastating impact on disabled workers who claim PIP. And let it be clear that PIP can be claimed by people who are in work as well as out of work. And this is a message we need to get across to Labour, because they're confused as well. They think it's just a benefit you claim if you're not working. It's not true. PIP is claimed by people in work, disabled people in work, and many disabled workers use it for getting to work, support at home so they can get up and get into work. And also it needs to be said, so we need support with this. And this consultation for PIP comes to an end on the 22nd of July 2024. But the Fit Note consultation with the reforms to Fit Notes will have a devastating impact on workers, whether you're in work or not. It will impact on us all. And I can't stress that plainly enough. We need support to push back on this Fit Note consultation. We need to tell the government we want our GPs to provide Fit Notes, and that we do not want a job coacher in a job centre telling us if we're not fit for work or not. That is a dangerous move by the government, and it is totally denying our support needs that we have. But we also need to talk that in the last week or so, that we have workers who are part-time workers working 18 hours, 17 hours or less. On the 13th of May, in came the administrative earnings threshold, where basically they're in work, but are being claim universal credit as a top-up benefit because they haven't enough money to pay all their bills or their rent and everything else, and they're claiming universal credit. And it needs to be said, we've got 6.7 million universal credit claimants, and many of this number are in work. In work poverty is rising. And we need to push Labour to say that, precarious work, 0 hours contracts, this fire and rehiring is totally abhorrent. We want decent jobs and decent pay for everybody, but also the support should be there when you're unable to work. And there are disabled people who are not well enough to work. And what you're going to see is the benefit sanctions rise through the roof and cause further distress and harm. We're already seeing with 14 years of austerity how the tragic human cost of austerity and how many disabled and older people have died as a result of this. But make no mistake about it, this Fit Note reform is absolutely horrific, and we need a robust trade union movement response. You need to take this back to your trade unions. The TUC Disabled Workers Conference is this week. If you're going, and I know there's emergency motions on this, have your say in that debate, but take this back to your workplaces, take it back to your trade unions, take it back to your trades councils, because people need to know that this is happening and the impact that this will have. because what this is about, the overall agenda with this, is the destruction of the NHS and the destruction of the welfare state. Because what the government wants is the duty of care from state, nationally to go, the duty of state from local government to go, and eventually replace the NHS with private healthcare insurance, replace the welfare state with sickness insurance. And if you can't afford those, you're going to fall through the cracks, because we're heading towards a private model of care. And I think it's so important, and I will end with this. Now, DPAC are having a day of action on the 10th of July. We're calling this Work Isn't Working. That for many of us, work is making people sick. Working 3 or 4 jobs, not being able to pay the bills, our access needs not met in the workplace. And I have to say that with access to work, there are 34,000 disabled people in the backlog for access to work, where their access needs are not being met in the workplace. That there are many employers who simply will not employ disabled people in the workplace. We need to do more on job sharing, flexible working, but also employers' attitudes need to change. We still need to continue to fight to protect our welfare state, but also we need to tell a Labour government we are not going to be taking more of the same as we've had under 14 years of a Conservative government, because Labour have already said they want to continue with the 2-child benefit cap, and that is having quite catastrophic impact on women with children, disabled people and families. But please, I'm going to share the links with Carol at the end of the meeting today, so you can have a look at the FitNote consultation, at the PIP consultation, and at DPAC's website. And I'm happy to take any questions you have. And I'm sorry it's a bit all over the place, but I think, I'm curious to know what you think and any ideas we can campaign going forwards. Thank you very much.
Thank you very much indeed, Paula. The situation is horrendous, isn't it? This has to be fought. This is just appalling. If anyone would like to ask questions or contribute to this, please could you put your hand up and I'll bring you into the discussion. And Sheila will keep up with the British Sign Language. So Ian, I can see Ian has put his hand up. Ian Spencer.
Good evening, comrades. A couple of things about my background. I'm a mental health, a general nurse and a mental health nurse. I did train in both because I trained in the olden days when you could do that sort of thing. I wanted to draw people's attention to a couple of important features. Undoubtedly, the COVID pandemic had a major impact on the numbers of people who were off sick. And moreover, that's a real thing. It's not that somehow, as a result of COVID, people have just decided to, we can easily pull a sickie now and talk about COVID. And I'll give you hard evidence for that in just a moment. I want to also draw attention to the fact that the people who are going to be recruited to be the assessors for this will not be exercising a clinical judgment at all. Even if they employ nurses, occupational therapists, physiotherapists, or paramedics, or whoever else to do it. And that's another thing I wanted to get across. These won't be clinical decisions. These will just simply be an algorithm that people tick boxes and fill the forms in, and then people will be deprived of benefits. More importantly, those benefits make sometimes the difference between life and death. And that I've seen with my own eyes as a mental health nurse, where I've seen people who have literally taken their own lives as a consequence of the loss of benefits. It will particularly badly affect people with poor mental health. notwithstanding the fact that out of all the people who are actually being on sort of long-term sick, only about 10% of those are for mental health problems. The other point I would want to make is that we need to think very carefully about what you do when we're acting with the Labour Party, for example. Wes Streeting has publicly in the Times, for example, talked about his admiration for the system of healthcare in Singapore. In Singapore, where, for example, at least 40% of the population has no access to healthcare whatsoever. It's a purely a pay as you go kind of system. If you're a Singaporean, you have healthcare, but it's gradated. So you know, if you can afford private healthcare, you get excellent healthcare, and about 40% of Singapore is one of these countries that actually imports its working class. So a lot of them will be Bangladeshis or Filipinos and people who don't have citizenship of Singapore. They're effectively there with the status of guest workers, and this is what Wes Streeting is talking about as a kind of admirable situation for healthcare. Let's move on to some hard evidence. Here is a study published in the Lancet. It's the Lancet Regional Health Europe, published in January of this year. So we can see that there are significant rises in excess mortality as a direct consequence of COVID, for example. This is a quote from the Lancet, this model finds that in the period from week ending 3rd of June 2022 to 30th of June 2023, excess deaths for all causes were relatively greatest for 50 to 64-year-olds, 15% higher than expected. So what we're seeing here is a real effect of the consequences of COVID. This isn't because they've all got long COVID. This is in large part because this is also in part because of things like people who, for example, have presented with cardiovascular problems, which is a major increase. So 12% increase in cardiovascular deaths from cardiovascular disease, 15% from liver disease, and so on. So people are presenting with disorders which are simply not being treated in a timely manner because the waiting lists have been allowed to grow, and very little has been done to redress the problems that have been caused by COVID. So there is a persistent problem of increased deaths as a direct consequence of COVID, and more importantly, the failure to act on COVID. Remember that Britain had some of the worst responses, had some of the worst mortality rates in COVID compared to any other kind of comparable economy. Yes, we did quite well if you compare us to something like Slovakia or Hungary or some such. But if you compare Britain with Germany, France, Norway, wherever, the kind of more developed countries, Britain had a very high mortality and morbidity rate COVID. Put differently, these measures are being taken as a response to the very poor handling of the COVID pandemic by the government. Also, there's in a study published in the Financial Times, which I'll conjure up in just a moment. The Financial Times survey showed there was actually very little evidence at all that this was a direct consequence of the growth of a so-called sick note culture. What's worrying me in particular is Mel Stride, the Work and Pensions Secretary, has talked in terms of doctors labelling or medicalising conditions which are just part of the ups and downs of life. And this is a kind of familiar kind of story I've heard time after time again, where, for example, something like anxiety and depression are just treated as kind of a poor response to the kind of ups and downs of life. Mental ill health kills people. and it kills people in large numbers. For example, the mortality rate for anorexia nervosa is about 10%. Imagine any other disease with a 10% mortality rate. You would think people would take it rather seriously. And yet what we've seen is the mental health services, above all, have been cut the most severely. And when we come to talk about 6 weeks of access to psychological therapies, what we'll often be talking about is actually pretty poor stuff. Cognitive behavioural therapy, which does have an evidence base to it. I'm not attacking it completely, but the idea of 6 weeks of CBT sorting you out is frankly fanciful. What I have seen with my own eyes as a mental health nurse is that often simply improving people's housing and benefits has such a massive impact on their mental health as to be well worth the money spent, quite frankly. And I've also seen the terrible effect that the transition from disability living allowance to PIP had on people with poor mental health. And this is where you start to see not only a rise in people killing themselves, but a rise in people who feel they have to self-harm in order to get any kind of be taken seriously at all. So in other words, you're actually creating the conditions for making people's presentation worse. So even people who don't intend to kill themselves, but maybe take an overdose, but get that badly wrong and end up dead. Suicide in the kind of younger age groups is after road traffic collisions one of the biggest single killers for people. And anxiety and depression are not just wake up one morning feeling a bit fed up. We've all been there, but we're talking about something which actually requires careful mental health assessment. If someone has very to harm them, has some and or you need to either pull yourself together or stop medicalizing it is just absolute bloody nonsense. So that's all I really have to say at the moment. Oh, just one other little thing. I used to be, because I needed to work from home for a while, I was a continuing healthcare nurse assessor, and what I was basically doing was contacting care homes to see whether the NHS could pay for people's care. And all I had really, I had no discretion whatsoever. All I had was effectively a sheet that I had to fill in, and I always tried to give people the highest score I could give them. But nevertheless, you had to have certain criteria before you got the NHS to pay for your care in a care home. Otherwise, you were left to the tender mercies of local authorities, and this was not a question of clinical decisions. This was not a clinical judgment, and my fear is that the people who will be doing these assessments in place of GPs, in place of even physician associates, are not going to be making a clinical decision. They're just going to be relying upon an algorithm, and that's it.
Yeah. Thank you very much indeed, Ian. I've got Mark. This whole situation is horrendous, absolutely horrendous. It's social murder, isn't it? Basically, it's social murder. I'm going to bring Mark in, Mark Metcalf.
Hi, cheers. Firstly, Paula, you've done a remarkable job, both yourself and DPAC for many years. To be fair, it's been, as you'll be more aware than I am, an often losing battle. So to be struggling continuously is to great credit to yourself and everybody else who's involved. Obviously, I was lucky enough to get an article from yourself it's the only booklet ever been done by a trade union on a disabled activist, which was Sean McGovern, who was in his own right elected onto the TC General Council. And I've put the link to that on there. Unfortunately, COVID stopped us having a proper launch for it. It's never really been properly launched. But what Sean's work does and what the people in the booklet do is to give some history and some depth, which obviously Paula couldn't possibly cover in such a relatively short but very important speech. So I would urge comrades to have a look at it. It was a pleasure to put it together. The question I was really going to ask is obviously the issue of Remploy, whether is this something that we should, as trade unionists, be agitating for? They obviously managed to get rid of Remploy on the basis of the fact that disabled people would be sectioned in essence, only working with themselves. As we know, once they got rid of Remploy, many of the people that were working at Remploy have never worked again since and are unlikely to do so. The attacks obviously on Remploy. I mean, we have to remember why Remploy came around. It was embarrassing to society to see so many disabled soldiers at the end of the Second World War. So something was seen, it was absolutely necessary that people should have work. Those that could have work should have work. And as we know, although we don't want to work ourselves to death, we do know that work is the main means by which people socialise and get to know others and to make friends. And so that's all. I wondered, without it taking it to a different direction, whether that's an issue, this is an issue of work, whether there should be an agitation for the places such as Remploy again. Thanks for your time.
Thanks very much, Mark. That is a very, very good point. As you said, Mark, having work that you can do will get you out of the house into a workplace where you can socialize with other people. I would have thought it would have been extremely good at doing something you can actually cope with, obviously, according to your disability. That would be a good thing for your mental health. It would improve it. So yes, this is a really, really important point. I'm going to bring Paula back again to see if she can give us some answers. What I would also like to do is to ask people, what's the way forward? What can we do about this? What response should we have to the survey, the call for evidence that the government has put out on this sick note reform? What should we actually reply there to that government survey? And Paula, also, as Mark says, what about more workplaces that will will give work to disabled people? And how can we fight for that? I'm going to bring Paula back in.
Wow, there's some pretty interesting questions. Going back to Ian, what we need, and I did say to Carol in the chat, what we need are more healthcare professionals to speak out about the impact of welfare reforms, about the impact of poor housing, about the impact of not being able to feed their kids, about the impact of constant testing in schools, Ofsted and everything, but also the kids' constant testing for exams, because we're seeing a dreadful rise of mental distress in children, especially primary school and secondary school children who just cannot cope with the constant testing. And also, Mark, when we've got people in mental distress who have better housing and they've got financial support, their mental health actually does improve. But what we need, and this is what we need to fight for, is funding for decent mental health services, which have been drastically underfunded for decades by subsequent governments. And a one-size-fits-all mental health system doesn't work. And I've had mental distress for 37 years. And many of us need long-term trauma counselling and are unable to get it. My partner's just last June, he was admitted to our local hospital, severely distressed, severely dehydrated. He was in the backlog for personal independence payments for 17 months. And when he was admitted, he had a complete breakdown. We were told that he would have access to the home treatment team. That never materialised. Then his GP referred him to the community mental health team, who farmed him off to the primary care plus team. where he waited 8 months for a managing your emotions workshop, which were 10 sessions with 2 weeks break in between. He's just had feedback, given them feedback on there, and the course actually made him worse. And you know something? It was sponsored by Mind. So I don't think we should ignore the charities' involvement in these schemes. And Mind have the DWP contract, 650 million quid's worth, by the way, for the individual placement support contract, which is basically people in mental distress will be referred to this service to give people intensive support to get into work and stay in work. MenCap, Scope, various different charities are heavily involved with the DWP and buying the rhetoric, setting up local employment schemes to get disabled people into work and keep them in work. We had DPAC members because we were involved in the campaign to save Remploy, and Remploy done some was a great project, and it was a great scheme that helped disabled people into work. In fact, one of our members, and I don't know if some of you knew, Stephen Hazelford, who passed in 2019, he was a shop steward at Remploy actually. Sean McGovern actually worked at Remploy as well for a while, and we did fight to keep that to keep the Remploy factories open. And I think that is a demand that we need to make to bring Remploy back into being. So we demand a service that supports disabled people, that meets their access needs. Regarding employers, many employers, you've got over 45% of disabled people are not in work because employers are very reluctant to meet disabled people's access needs because they often say that, it's our insurance, we can't afford it, we can't afford to meet the access needs. And as I said in my chat earlier on, we've got 34,000 disabled people in the access to work backlogs where their needs are not being met. And I have to say, trade unions are also failing disabled workers. Unite, for example, do not provide flexible working, do not provide job sharing. Do not, and this is something that trade unions need to take a leaf out of their own book. Not everyone can do 9 to 5. Not everyone can do, more than a few, many can't do a few hours, and job sharing would be helpful, flexible hours. And although, the government have brought in flexible working, you have 2 requests a year you can make for flexible working. Often employers turn down flexible working because it doesn't meet the needs of the business. I do think employers need to do an awful lot more to incorporate disabled people into the workplace with access needs to be met. But employers won't do that. And I think the government needs to seriously address that. But also, I think we need to take on board that there are people who are not well enough to work, who shouldn't be pressurised like this. And when you're seeing a job coach with 3 weeks worth of training, being the people who will be issuing fit notes and basically deciding if you are fit or not, I think is absolutely worrying. It's deeply, deeply concerning. And to be honest with you, as Ian's already pointed out, what you will see is a massive rise in mental distress. You will see a massive rise in disabled people's conditions deteriorating. And DPAC have already said this most strongly. We are going to see an awful lot more disabled people die. And I think it's really, really important to stress this, that from the Department of Epidemiology and Community Health, that from 2012 to 2019, 334,327 disabled people and older people are dead as a result of poor housing, poor nutrition, precarious financial support, it being taken away, prematurely died as a result of that, died as a result of austerity. And that people were dying under a Labour government as well. And it's really, really, really important that we have a clear set of demands going forwards, that we want the GPs to continue issuing fit notes. The DPAC's response to the consultation was very blunt, and it wasn't a lot. It basically said, we want our doctors to assess us if we're fit for work or not a job coach with 3 weeks worth of training. And we said to the PIP consultation that they need to keep, they need to keep PIP, and if they go ahead with these reforms, they will kill people. I think it's really important. But Ian, if you're able to, we need you to reach out to more of your colleagues and get more healthcare professionals to speak out about the result of these reforms, not only what's coming, but also what's been happening in the NHS, but also spread the word, because there's still an awful lot of healthcare professionals who are still very unaware of the tragic impact of these reforms and what they are doing. And we need more and more people to come forward, speak out, and join their voices with us, because we're stronger together.
Thank you very much, Paula. It is really, really upsetting. It's just awful. And I'm sure everyone here feels the pain and the distress that disabled people have been going through and are going to go through to an even greater extent now. I've got Steve, and then Peter, and then Tim. Steve Freeman.
Okay, thank you, Paula and Sheila, as well for your contributions. I have this feeling, and I want to try and think about the politics, because I think there is a trade union response, and that we're talking about here. But I think we have to have a political response, which is a bit difficult when we think of the Labour Party and the Keir Starmer government. So we're in a bit of a bind. We need a political response, but it's not clear what that political response should be. I feel like we're on a downward escalator, and the problem we're on a downward escalator, you can keep running up the escalator, but all the time you keep going downwards further down. That's what really worries me. I think that's for the country, not just for disabled people, but you might say disabled people are at the sharp end of this downward escalator. So I think we have to stand back a little bit and think of the sort of context, which is the destruction of the 1945 welfare state. Now, that 1945 welfare state is the historical background to this. And if we understand that welfare state correctly, as not just the NHS and so on, not just the welfare aspect, but the political and constitutional aspect, that we are governed through the Crown in Parliament. And I'm going to come back to that. So the failure that we've got is not just of the destruction, which began in 1979, carried on through the 80s and 90s, and then took a massive leap up after 2008 with the financial crisis. After 2008, everything got 10 times worse, 20 times worse. I don't know how many times worse it would be. But that's so this downward escalator is going faster through time. But it's not just, as I say, the welfare state, it's the constitution, it's the Crown in Parliament, if you like. And today we've just had, and it's relevant, I think, the blood scandal. The infected blood scandal. And what the infected blood scandal shows all of us is that, well, they'll call it the state, the Crown has completely acted against these people over 30 or 40 years. Lied, deceived, tore up documents, terrible crimes actually are being carried out, and Sunak's apologising on their behalf. But the problem is that there is too much power in the hands of the Crown, which means in practice the DWP, the Department of Health, the Home Office, the Treasury, and all these other bodies. So I think, you know, I'm coming around to saying what we actually need is a constitution. We need a new constitution. That is to say, a new set of rights. And that includes legal rights for disabled people. That would have to be very much a part of that. We'd have to have a national legal service to make sure people could get those rights enforced. So I think we've got to step outside the Labour Party and say what we need in this country is democracy. Because it's not just the blood scandal is a complete and utter failure of Parliament to monitor anything, to expose anything, to tell the truth or do anything about it. So the blood scandal is a complete failure of our parliamentary democracy, so-called. So resistance, protest is absolutely necessary, and I completely applaud and support that resistance. But if we don't have a bigger picture about the kind of changes, the kind of democratic changes we need, then we are stuck with nothing other than the hope of Keir Starmer, which we know is a complete and utter waste of time. So I think I'd end up by saying let's try to think about how the left can take up a much more political and democratic approach to the problems that we've got.
Thanks very much, Steve. I've got. I just want to come in here with a question from Jennifer Devlin. I think she's had to leave the meeting, but I wanted to ask her a question. Radio 4 today at 4 p.m. on Broken Politicians, Broken Politics, about how large numbers of MPs are suffering serious mental health problems despite not having the housing, employment and financial problems that many people suffer, including particularly those who are sick or disabled. Might these MPs be more sympathetic to changing Sunak's unbelievably cruel narrative than your average hard-nosed MP? I thought that was a really good question. Thanks, Jennifer. I'm going to bring in Peter Grant now. Can I ask, we've got lots of hands up now. Can I ask people to stick to a maximum of 3 minutes, please, to ask your question or make your contribution? I'm adding Peter Grant now.
Yeah, thanks. Very interesting talk and very frightening, to be honest with you. Obviously, we knew a lot of what was going on, but not to the extent that you've outlined it, Paula. So I'm very grateful for that. One of the things I would like to ask you, which caused me a great worry when you mentioned it, the actual signing off people from work, you're saying it's going to be farmed out to 3-week trained idiots, basically. Where does that actually lie with companies that have policies on mental health and how to help people that have had a traumatic experience or whatever? What I'm getting at is I'm a retired train driver, and one of the issues, obviously, for me would be that if you were involved in an incident, especially what we term a one under, that it takes something between 6 to 12 months to get a driver back into the cab in a fit state to drive that train. If they're going to farm that out to these people that are going to refuse them a sick note or actually only give them one for a few days or a week or whatever, and expect them then to go in front into the cab and drive a 125-mile-an-hour train in a state of mental distress, that the dangers there are absolutely obvious. And the other thing is that what you've described to me means that there's going to be a hell of a lot more people. Unfortunately, there's going to be a hell of a lot more people that are going to be jumping in front of trains, because this has happened before. We've had, when pressure's been put on people, the rates of suicide go up. And one of the favourite ways of ending your life, unfortunately, is by throwing yourself in front of a train. And as somebody that's had it happen, I know the consequences of it and the suffering that you have. Even now, I think about it. It's not something that ever goes away. And to actually, you know, see somebody on the track in front of you and you slam the brake on and there's nothing more you can do, and you see that person look at you as they go under the train, is horrendous. And for that to be denigrated to an offshoot of the DWP frightens me to death. It really does frighten me. Anyway, thanks for your talk.
Thank you very much, Peter. Thank you for sharing that as well with us. Thank you so much. I've got Tim and then Jamoki. I'll bring Tim in at the moment.
Right, okay. My question's a short and simple one. In the late 1970s and early 1980s, I was working in a bank in central London. And we had a colleague there who used to come to work in a wheelchair, park his wheelchair downstairs, take the lift up, then walk the few steps to his desk. Now, he had a job as a disabled person under a quota of, I believe, 3% of all jobs of a company with more than a given number of employees, and his job was protected until he reached normal retirement age. Now that was by law. Is it still a legal requirement that organisations should give a certain percentage of jobs to disabled people? That's my question. Thank you.
Thanks very much, Tim. Very interesting question. I'm going to bring in Jamoka. Jamoka? Oh, thank you.
Jamoka, you're there?
Yes.
Yes. All right. Paula, clarify the sick note. Because I'm not really, no, Paula, thank you for clarifying about the sick note, because I wasn't quite sure what it meant. With deaf people in job centre, they never provide interpreter. And we are deaf, and we need interpreter because, you know, how are we ever going to make it meaningful and working for us? At times we complained and we asked them to give us the interpreter because they're forcing us to go back to work, do this, do that. And then explaining them, A, we have health problems, B, we have communication issues. We can't even communicate with you. And the way how these meetings go, it's creating quite a lot of stress. And then even before we manage to do anything, they just close the meeting, and that leaves me very, very distressed. Then I have to go to ask my sister to leave her work, to come to accompany me to the job centre so I would be able to talk to them. And then the basic thing is that I keep explaining is that I need interpreter, that I need a communication support as a part of anything else. They stopped my benefits. Then I was very upset because I couldn't. You moved where? A universal credit. Then they changed the benefits, whatever she had before. They merged with universal credit. They've asked me questions. I didn't understand. There wasn't interpreter there, so I couldn't quite understand what was going on. So the whole meeting went really horrendous. Job centre should know better. They should know that it's the DWP that they need to provide communication support to people like myself. They also need, they need to know that the deaf people, they need interpreter, they need access to communication, they need support when they come to meet those job coaches, and they provide nothing of that. And yet they stop our benefits and they force us to work.
Thank you very much indeed. My goodness, what a terrible experience. How awful your experiences have been. Thank you so much for coming on the call to the meeting and letting us know how bad things are for you. I mean, for goodness sake, there should be an interpreter. There should be someone who can do sign language, like Sheila's been doing magnificently for us today. I'm really, really shocked that that isn't provided. And thank you so much for coming on and giving us your story. It's people's stories that really hit home and show us how awful things are. Thank you so much for doing that.
Sorry, can I just jump in whilst I'm here and Jamoki's here? It's not kind of exception. It's very, very much common that deaf people in job centre, in these assessments, interviews, to force them to search for a job, never have interpreter. And many times they actually phone me on my work begging for FaceTime so that I can interpret between them and DWP. So it's loads of times it happens that they simply don't, they have all these requirements, but they never put requirements themselves. It's like loads of double standards. I'm sorry, I have to go now, but I will put my email for deaf people, or contact me through Instagram. Yeah, you can through Instagram, I'll put there, or I will put my email address, okay, from Tara.
Thank you so much. You've done a marvelous job, Sheila. Thank you so much. Thank you for coming today. That's marvelous. If you can send on anything I can send on to other people, that would be brilliant. Thank you so much, Sheila. I'm going to go. I've got two more people. Paula, do you want to come back and answer some of those questions now? Because I've still got two more people who would like to speak. Paula, what would you like to do?
Just coming back on the 3%. Employers do have a duty to open up the candidacy to disabled people. They have now called a disability confidence scheme, and employers have what is called a blue tick symbol for the roles. Unfortunately, there is still massive issues within the labour market of hiring disabled people. There is a 48% gap between disabled and non-disabled workers. The pay gap, non-disabled workers are paid double what a disabled worker is paid. Like I say, we have the Equalities Act now, which basically job seekers are covered by the Equalities Act, but you still have this issue about disclosure. Do I disclose or not? Because when you do disclose, many disabled applicants are often not given a second look. They don't even get to the interview stage, or they're not given feedback on why they didn't get through the interview often enough. So I think employers need to do more to employ disabled people. That's without a doubt. They need to do more to around access to work and putting reasonable adjustments in place. But also I think that working from home needs to be more expanded. But also what Jamoki has experienced with the DWP is not an unusual occurrence. Deaf community often complain about the horrendous way they've been treated by the DWP. And I'm going to share a story of a deaf man, actually, who was on job seekers allowance. And you've probably heard this story in the media. He was awarded 50,000 in damages by an employment tribunal for oppressive and wrongful treatment by staff at the DWP. His name is Paul Rimmer from West Yorkshire. He's profoundly deaf and his first language is British Sign Language. He's spoken no English and basic reading and writing. The tribunal found that the job centre failed to provide him with the BSL interpreters on a number of occasions between 2017 and 2023 when he was claiming JSA. And a disability employment advisor attempted to block him from receiving more intensive employment support and suggested increased use of sanctions to push him into work. It comes as the government continues to drive to push disabled people into work. He said in his witness statement, "I do feel that the job centre and the DWP have not wanted to help me because it's too difficult and too expensive for them. I also feel that most DWP staff do not understand the difficulties facing me as a profoundly deaf person." And when he was sanctioned in 2017, and he had his benefits suspended for 2 weeks because there was a lack of evidence he was seeking work. He said this because interpretation and the help he needed with writing in English to complete job applications was insufficient. And, you know, this is the kind of thing that, you know, BSL users report all the time, that there is not BSL interpretation, not just in job centres, but in healthcare as well. That provision isn't there. And more needs to be done to make sure that all of our services have full BSL so that BSL users can participate and be fully included in life. And that includes employers as well. And even fire exit signs are not in BSL. And even my own union, Unite, we're having to have a campaign to have fire exit in BSL. We shouldn't have to do that, you know, but we do. But yeah, we need to fight to make sure that all of our services have BSL interpreters as standard, and that BSL users and the deaf community are fully included and able to participate in life. And that should be the demand for, you know, going forwards. But regarding, employers definitely need to do more. They're not doing enough. And I hate to say, you know, when you've got trade unions who won't even look at how to make workplaces accessible and, look at flexible working. Everyone thinks everyone can do 9 to 5 and everybody can't do that. People can't work 40 hours a week. For many, that's just impossible. And I think they really do need to encourage more flexible working, more home working, more job sharing, to increase the workforce. And that's something I think the trade union movement need to seriously look at and campaign around.
Absolutely, Paula. I'm just going to bring Jennifer in and then John. Jennifer.
A quick question for Paula. You're in Unite, the union. I'm in Unite Community. I wondered if you will presumably be putting together a national campaign to involve people in taking part in the consultations, etc., and getting some kind of narrative going nationally, so that people understand what's going on. I just wondered if you're going to involve Unite Community in that, because obviously many people in Unite Community will have a direct interest in what's happening.
Sorry, I didn't make it clear, Jennifer. I'm a Unite Community member too.
Right.
I'm chair of my branch, Bromley and Croydon, and I'm chair of London and Eastern Unite Community Campaign Forum. I'm also the observer for the London and Eastern Disabled Members Committee. I have raised the FitNote consultation with my region. If you're on the area activist committee or you know people who are, this is a really important place, because Unite Community members only have the area activist committees to raise motions and to raise campaigns. Also, I would say contact your regional secretary in your region. I did with mine. He's Steve O'Donnell for the London and Eastern region. I raised about the FitNote consultation, and I've got to say, Jenny, the personal independence consultation, because there are disabled workers claiming bit. you know. So yes, it has been raised with Unite. Trade unions across the movement are aware of it. The TUC Disabled Workers Conference is this coming week, next couple of days. And I do believe emergency motions have gone into that conference as we speak. So I think we need to put the pressure on all angles, but also, you know, as I'm a Unite community member too, and we have many DPAC activists who are Unite community members, and we work closely together. I think it's important, the 10th of July, to get members involved in that day of action, whether you wherever you live across the country. We want to have a day of action. Work isn't working, and let's have these conversations and about our demands. What welfare state do we want to see? What are our demands? What we know what the government are doing will never work, will not help. We actually, I think there's research that's been carried out with what the government want to do, will only get 33,000 disabled people into work. What they're suggesting, the reforms they're suggesting are they're in a hiding to nowhere. What this is about is to cut the welfare bill down. They're not really interested if we can work or not. They just don't want people claiming. And that is what this is about, is to shrink the welfare bill and just get people out of the system, full stop. That is what this is about, to be honest with you. But yeah, I think raise it with your area activist committees, raise it in your branch, but also if you're twinned with industrial branches and you've got observers on the industrial, on the regional committees, you know, get them to talk about it. But Unite are aware of it, and they are having responses to the consultations. But I would definitely say take the word back on the 10th of July. We need trade union support out on the street on the 10th. It's so important that we are unified now, you know, because this is going to have a tragic impact. It's going to have a catastrophic impact on workers, and they need to be behind us, because it's only as a unified front are we going to push this government back. Because if we don't, we've had it.
Thanks, Paula, and thanks for all you do.
Well, thank you. I'm just a small
You're
part in a big
tower of strength. Thank you.
I'm going to bring in John and then Steve for another go.
Hi there. Yeah, thanks, Paula, and everybody else. It's been, yeah, I mean, it's just so horrific for what's on the cards. As Paula was saying, this isn't just about, well, money's obviously a factor in it, but this is an ideological strategy, you know, by this government to try to turn us against each other. We know how much discrimination there is and has been against disabled people and people out of work and so on. And so we're basically, you know, what they're doing is they're basically finding people to blame, sponges and all this. You know, that you go to your doctor to get a note and you're not actually sick, stuff like that. So I think, I mean, what I kind of, I mean, you've got this consultation until the July the 12th, which isn't very long, but if for instance, they actually produce legislation after that consultation, maybe quite a way down the road anyhow, by the time they actually get the legislation through Parliament, we're going to be pretty close to, you know, an election. And if this campaign we're building can roll until then, it could be a big campaign, not only to put Tories under pressure, but to put the Labour government under pressure. It's something that could roll, maybe, particularly as well with the industrial, you know, strikes that are happening at the moment, although not so many at the moment. But As far as the BMA goes, and also the Civil Workers Union, both those unions are very strong unions. And I was just wondering what basically the response of the BMA and also the response of the civil servants union. Yeah, that's all I've got to say about it. Yeah.
Thank you very much, John. I'm going to bring Steve in now.
Thank you, Carol. It's just a short question, really, Paula. I was thinking about this idea of a constitution being basic rights, people having basic rights, the rights of people, fundamental rights, if you like. So I'm wondering, is there anything that in your knowledge, I mean, all the knowledge, experience and campaigning with it, is there anything where you'd say this is the basic rights that we think disabled people should have in this country? Is there things that disabled people want written into a basic law of the country that said that this is a right and it's going to be enforced by the people? We're going to have these laws passed, and then everybody's got something in a constitution that is clear to every person, that you can read that constitution and know that you've got rights, and you can go along to an employer or any other body and get those rights enforced. And that for me is something that, you know, needs to be done. I don't know if there's anything like that, whether you've got a document like that or anything of that type exists. But so that's my question. Does anything like that exist? And could we, and is it possible for your movement also to think of that as another part of this, of what we need to do, as well as all the fantastic campaigning and resistance that you're doing to this continuous attack on disabled people?
Can I come back, Carol?
Absolutely, yes.
Right. Okay. The right to independent living is not enshrined in UK law. The right to food is not enshrined in UK law. So there's two there. The right to food and the right to independent living. There's two. I would say the right to decent housing, you know. Housing should be a human right, a universal human right. We should have universal healthcare free at the point of need, social care publicly funded, funded by progressive taxation, free at the point of need. No one should be having to pay for social care or to sell their houses to end up in residential care, where you've got multimillionaires creaming off these contracts, living in big houses, and people paying for their social care. The other thing, the United Nations Conventions on the Rights of Disabled People is not ratified into UK law. Labour have already said they've got no plans to do that. That should also be another demand, that the United Nations Convention of the Rights of Disabled People should be ratified into UK law. We should have, access to the legal system, the right to work, decent work, and they should be universal human rights for all of us, not just for disabled people, but for every single one of us. They're just, some of them. And also, you want decent pay for a day's work to put food on your family's table, keep them warm, keep them fed, and you want an education system that supports your children, not just the way that our education system is going now. And to be honest with you, when you're seeing over 12 million people in this country in poverty, 4 million disabled people in abject poverty, you're seeing 5 kids in a class who haven't eaten that day, are eating rubbers because they can't get access to free school meals because their parents' income takes them £1 over that threshold. What kind of society is this? This is the 5th richest country on earth. And we're seeing a return to, we're now seeing bed poverty, where parents haven't got money to buy beds, where kids are sharing beds, where they're sleeping in baths, where they haven't got food, they haven't got clothing, what kind of country is this? we should be demanding better, we should be demanding that food should be a unit, food should be a right, that housing should be a right, that the right to independent living should be a right. But what we're seeing is, and what concerns us as well, and wherever you sit on this debate, it's not by accident that you're seeing Scotland, the Isle of Man, Jersey, France, Spain have adopted it, and you're looking at England. Starmer's already said he supports assisted dying, and so does West Streeting. What concerns disabled people in the movement are that when you've got cuts to social care, when you've got cuts to healthcare, when you haven't got money to eat, that disabled people are going to feel burdened, and that the only choice is to die, basically. And I think if we're to have a debate on assisted dying, we should make sure that we have our healthcare system, a decent social care system. We've got the right to eat. We've got a decent home, and the fact is everyone deserves a good death. But when that choice is taken away because of social economic policy, it's a dangerous time for disabled people. And I would say to you, you only have to look what's happening in Canada with medically assisted in death in dying, where they're using social economic policy to deny people, disabled people, treatment. And you've seen a 22% increase of disabled people applying for MAID. Do you know in Canada, there's a 10-year wait for social housing. There's a 90-day wait for medically assisted in death dying in Canada for disabled people. And that needs to be stressed. And going back to Peter, my heart goes out to train drivers every single day. And we're seeing a massive increase of people taking their own lives at train stations. I've shared this story and it's heartbreaking for me. And I felt for the driver when my friend Carol took her own life on the 16th of December 2010. And I was the last person to hear her. When she was found fit for work after a work capability assessment, she took her own life in front of a train. And I had to break the news to her husband and her 2 kids. What a train driver goes through, what the train staff go through, and the torment that poor person's going through, no one should have to go through. But when you've got job coaches who could decide that person should go back to work when they're heavily traumatized, is totally wrong. And we haven't heard much response from the RMT and ASLEF on the fit note consultation, but I think there needs to be pressure mounted with the RMT and ASLEF to look at the fit note consultation and the impact of trauma train drivers go through, and the sheer amount of stress driving a train. People don't understand that. But I think, we need a basic set of rights that we need to demand. Unfortunately, with Starmer and what he's proposing, what Rishi Sunak's proposing, there really is no difference between them, sadly.
Yeah, this is, my goodness. This is really, really upsetting. Hearing
change comes from us. It always has.
Yeah.
So regarding, somebody asked the question about MPs and their mental health, and would they speak out about what's happening to us? The question is no, because they are whipped to vote a certain way, because a lot of these reforms to them, what matters to them is the electorate, because the narrative around from the electorate with our mainstream media is we should all be working and, we shouldn't be claiming and all the rest of it. And the wider public are buying into the narrative. They really are. And the MPs are acutely aware of that. And often when we've spoken to many MPs, they're not actually aware of the impact of these reforms until it's too late and their constituents start coming to them. And and to Jamoki, I know she's left the call, but I would say I would put in a complaint to the MP, and I would definitely put a complaint into the DWP, definitely, and the blatant direct discrimination she's faced as a result. With the PCS, 42% of DWP staff are claiming universal credit, and many of the staff are on the national minimum wage who are carrying out these reforms. It's sad to see that the DWP staff didn't vote for strike action. The turnout was very low. I think there's apathy. The department is rife with bullying as well, and they're terrified of speaking up because of retribution from up high, I think, as well. And it has to be said, when you work in a civil service, you have to be apolitical and you can't speak out, and your social platforms, social media platforms are monitored. So you have to be careful. And as many workers already find out, you can be pulled in for a disciplinary for having views on certain things or criticising your boss or anything like that. And I think, so yeah, we need to do more about basic rights. Also the right to protest, because that's under attack. And also I think we need to continue to push back about this surveillance bill and our bank accounts monitored and stuff like that. And I think that is a really, really heinous policy. Big brother watching us and everything like that. So yeah, I think what's important is look at the consultation, spread the word amongst the trade union movement, support DPAC's action on the 10th, write to your MPs, but also remind them there's a general election coming up. And if they support these policies, just remember to tell them where don't get too comfortable claiming your MP salary, because you may not be in that job much longer.
Absolutely, absolutely. Could you help us a little bit more, Paula, with the government survey that they're doing? How should we tackle that? Do we tackle that as an individual? Do we tackle that as a union? How do we get into that survey and make an impact?
You can reply individually, if you wish to. You can reply as a branch at your trade union. Nationally, I'm sure your trade union is responding to it. You can put motions into your trade union. I know, like Unite the Union has equalities conferences coming up the 28th to the 30th of October. I think, yeah, you can respond as individual, as a branch, or as a trade union, however you wish to. Our response was very direct. We want our GPs to continue to issue fit notes. They're the ones that know us. We don't agree with this policy because it will kill more people and cause more harm. And that was all we needed to say.
Great, thank you very much for that. And the financial argument that the government's trying to put forward is, of course, absolutely untrue, because the amount of money unclaimed benefit, the amount of money that is involved in unclaimed benefits is phenomenal. It's really high. And so their argument that there isn't any money is absolute nonsense.
There is money, but then when you think about this, and this is something, if you've got a Tory MP, when they have a hustings, ask them about the 155 billion they wasted in 5 years. The scandal of the PPE contracts. Yeah, that is the questions they need to, and watch them squirm, because they know the amount of money, and the 155 billion, how many nurses, how many doctors, how many teachers, how many social workers, how much good that could have done in the mental health system, supporting our communities, the Sure Start centres, the services we are being denied because they are wasting money. We have got to hold them to account to it, and also put a stop to the corruption that they're waging in Parliament. Because in local government, there is a rule that when you've got a vested interest in a company or something, you can't vote on a debate in a council chamber. But in Parliament, you've got MPs with vested interests in the private healthcare companies who can vote on NHS contracts because they profit out of it, and that should be put a stop to. And a constitution should be a demand that, you know, MPs should be voted by the people, for the people who've got first-hand knowledge of the issues around social housing in our education system, not these careerists who haven't a clue of the issues we face. And it's just a career to them to be comfortable. It shouldn't be that way. They should be people who've got first-hand knowledge of these issues we're facing and what we can do about it to sort it out.
Absolutely. So many things that can be done. Well, I just want to, I've got no more hands up now.
You must be knackered from listening to me, Phil.
No. It's all been amazing, and absolutely on the nail. Absolutely on the nail. We need a constitution. We need these rights to be enshrined in that constitution. Britain hasn't got a written constitution. Everything's decided by the Prime Minister, who then whips the Prime Minister and the ministers, who then whip all the MPs to vote the way they want. We have no democracy whatsoever. We need that constitution with those rights outlined.
I think the last parting shot from me, when Cameron talked about in his 2015 manifesto about the British Bill of Rights, and people don't often talk about that terrible policy that he wants to bring in, because under that, he wants to remove the right for a fair trial and just be locked up indefinitely. Well, he's already doing that. The government are doing that to Julian Assange right now. He hasn't got access to a fair trial or anything. He's been locked up in Belmarsh in solitary confinement for the past 7 years because he dared to use freedom of speech. And what kind of country is this, where they just lock someone up and they take a journalist away, lock them up in solitary confinement, a category A prisoner, and do something like this, but also takes away our right to criticise the government by going out on the streets to protest about policy we don't agree with, and they want to shut down protest and not let us criticise the government. So, I think there's plenty we need to do. But, DPAC's response was very stark. These reforms are wrong. It's going to kill a lot of people. They're harmful. We don't agree with it.
Absolutely. Well, I just want to say, I know John's got his hand up, but we're well over 90 minutes now. So I'm going to go, and I'm sure Paula's very, very tired as well. She's done just an amazing job. Everything that you've said has been so clear and so helpful and so informative, and made us realize just how terrible this is. The government is literally trying to murder people. That's how serious it is, just like they're trying to murder Julian Assange at the moment. So I'm going to bring the meeting to a close now, because I think we've all had an amazing meeting. Thank you so much, Paula, and please pass on my thanks to Sheila for doing an amazing job with the sign language. She must have been very tired by the.
Do you know, when you go out on a protest, look at the word democide in the Collins Dictionary. And the word democide is this: that a government, either directly or indirectly, directly by government policy or by its totally indifference, the impact of, so by policy or by its total indifference their policy is killing its citizens. You look at the word democide in the Collins Dictionary, this government are guilty of democide. Because their policy directly and by its lack of care and indifference is killing tens of thousands of its citizens today.
Yeah, and that's the blood scandal as well, Paula.
Yeah, and the blood scandal. But you look at the policies, 14 years of austerity, the blood scandal, and a lot of others, this government are guilty of democide. And I think that needs to go out onto placards and everything, and people need to speak about that a lot more than they are.
And I think what you said about in Canada, that the waiting time to get on the housing list is, what did you say, 10 years? But in 90 days, they can go for euthanasia. That
Yeah.
is a horrendous
If you,
social,
yeah,
social situation.
there was a documentary that was aired last week. It's called Better Off Dead ? By the actress Liz Carr. It's on YouTube now. It's on iPlayer, BBC iPlayer if you've got BBC. It was aired on primetime TV last Tuesday. Have a look at that documentary that she's presented. You see what's going on in Canada, but also we need to have that debate around assisted dying. While we've got the social economical issues that we've got, this isn't the time for this debate. But I think have a look at her her documentary and decide for yourselves. But it's an important part of this discussion, we feel.
So what's it called?
And I'm in it as well.
The name of it? Better
It's
Off
called
Dead.
Better Off Dead ?
Wow.
I can send you the link, Carol, and
Yes,
it's on
please,
YouTube.
please do. And please,
And
can
you
I
can
ask
watch
you,
it.
you know, I know you put them in the chat as well, but if you could send me an email with
I
all
will.
the links and so on, and how we can get involved in that government survey, so I can send it out to all my
Yeah.
groups. That'll be
But
really,
also
really
we're working on the campaign for the 10th of July, but we really do need solidarity on the day. That would be massively important to us and really welcome.
Thank you. So if you can put that all in your email, and I will send that out to everybody that I can. So thank you very much, Paula.
Pleasure.
It's been a shocking and saddening meeting, but a very important one. So I just want to say thank you to you, and thank you to everyone that's contributed and asked questions.
So everyone, don't be sad. Organise, agitate, mobilise, and kick some government ass. That's what we're doing. Join us.
Excellent, excellent. We'll end on those words. Well done, Paul. Excellent words.